Thanks again for joining us today. I am also very grateful for our speaker today, Paul Sadler, who has accepted our invitation to present our first webinar of the week, 5 Pillars over 5 years, Distilling the Reforms. How will the next 2 years look? Now, I'm sure that our audience is really looking forward to listening to your presentation, Paul. So we'll just mention that you are the CEO of Aged and Community Services Australia, ACSA, and that you have more than 35 years of experience in the industry. And Paul, you've also held a number of board and representative appointments in multiple organizations, including Presbyterian Aged Care and the Association of Gerontology. Paul, thank you so much for joining us today. Over to you.
Thanks very much, Lorraine. I'm just going to share my screen for everybody. So hopefully everybody can see that.
Yes, we can.
Excellent. So I would like to start also by acknowledging the traditional custodians of all of the lands on which we're meeting today and pay respects to elders past, present and emerging. So my task today is to give you really an overview of what is happening in the home and community care space. And to do that, I'm actually going to go back to history. Back in 1986, the Home and Community Care, or HAC program, was actually created, and that happened to be my first year of employment in Northern Sydney. Shortly thereafter, I actually spent some time as treasurer and chairperson of the forerunner of your side. The Home and Community Care program was itself a unique program, bringing a national focus to the delivery of home and community care services across the nation. But it was also something which emerged and developed over time. So there were reviews, 1991 to 93. There were 2 major reviews that were undertaken. In 1992, we saw the forerunners of what became home care packages, Commonwealth, the community aged care packages and the extended aged care in the home packages. We saw in 1997 major reform nationally with the Aged Care Act. Through the 2000s, there was another focus on community care reform called the Way Forward. In 2011, we had the Productivity Commission Care of Older Australians report. And as a response to that, the Living Longer, Living Better reforms were introduced. And we moved from the state-based home and community care program to the Commonwealth HAC program. And in 2012, New South Wales moved its HAC services across to the Commonwealth-only funded HAC program with a focus on older people. The current home care package structures were introduced in 2014, the 4 levels of funding that we're familiar with now. And in 2015, Commonwealth HAC was moved into a new structure called the Commonwealth Home Support Program. And the intent to merge with home care packages was actually announced at that point. Home care package funding transferred to the consumer in 2017. And in 2018, we had a series of further consultations on home care reform with now a 2020 deadline for merger of CHSP and home care packages. 2019 saw the last of the state HAC programs transfer to Commonwealth Home Support in WA. And of course, we all know we had the Royal Commission in 2019 to 2021. In response to the interim report, the government re-announced the merger of Commonwealth Home Support and home care packages. And this year, in response to the final report, we've had the confirmation of a CHSP extension to 2023 and intent to create the Support at Home program. Now, why do I go through all this history? Well, primarily because it's important to learn from history. And the first thing to learn is that neither home care packages nor the CHSP HAC program have been perfect solutions to the issues on the ground. The HACK program focused on funding individual providers, each doing one service type, really didn't work well for people with complex needs. But the alternative home care package model of 4 levels of funding has proved to be inflexible, and it's over-allocating money to many individuals, which contributes to long waiting lists and increasing unspent funds. And managing all these now nearly 200,000 individual budgets is administratively complex. We know that on balance, most older people don't want to self-manage, but there's a growing number that do and definitely want the option into the future. And we need to learn from our colleague areas like the NDIS. And we don't want to do what they did, eliminate block funding of social infrastructure entirely, even for thin markets, and then have to reinvent it. We also know that access into the system is difficult for older people as they navigate the complexities of my aged care and the separate assessment processes for low and high care. So, what did the Royal Commission final report actually come up with? Well, of course, it was primarily a report and an inquiry about issues of substandard care. And they found that around 30% of people using aged care services receive substandard care at least once over their time in care. And their conclusion was that that extent of substandard care is deeply concerning and unacceptable. What they also found, though, was in a 1997 cabinet memorandum, that's at the time of the establishment of the Aged Care Act, that the current system was an unenviable trade-off between the health of older Australians and a desire to save on public expenditure for that help. Successive governments, in the words of the Royal Commission, consider aged care as a form of welfare for the very needy to be provided to the bare minimum extent required. The Royal Commission documented underfunding over the decade and a half subsequent to the Aged Care Act being introduced that amounts to nearly $10 billion per annum, which is 58% of the total expenditure in 2018-19. There's 2 main reasons for that. The first is inadequate indexation, which has eroded the value of CHSP and home care packages by 22% over that period of time. And also the rationed supply, particularly on the number of home care packages available, which has reduced government expenditure by a further 25%. The Royal Commission found that there were systemic problems in the aged care system. I'm not going to go through all of these because you're probably quite familiar with them. I want to point out a couple of them. They did feel there was an absence of leadership and governance at a system level by the government, and that was tied to the insecure and insufficient government funding levels. But it was also tied to things like inequities in means testing, not paying attention to local conditions for the evolution of a market, and an overall piecemeal approach to reform. But they also highlighted there were issues with provider governance, management and leadership, and an undervalued workforce. At a societal level, attitudes and assumptions about ageing and aged care were very much a contributing factor. The Royal Commission felt there was a lack of voices of older people in diverse communities in aged care, an absence of transparency in the system, and very importantly, a poor cooperation across the health and aged care systems, which often underpin some of the issues of poor quality care that the Royal Commission identified. In response to this, the government has identified 5 pillars for aged care reform. And I would reckon all of you have seen this either in the government response document or in various slides that the government has been using subsequently. These are the 5 pillars with the key actions over a 5-year period. So pillar 1 was around home care. We're going to dig into this in a bit more detail. There was a pillar around residential care sustainability, It called it Pillar 3 residential care quality, but it actually includes home care quality issues. It's a pillar about the workforce and a pillar about governance. Aged and Community Services Australia believes there's a sixth pillar, which is not in the government's response, and that's around housing and retirement living. For example, if we want to get home care right, people need secure housing. So we do believe housing policy is really important as an adjunct to the 5 government pillars of reform. So what does the future look like through the prism of the 5+1 pillars? So there are major changes that are flagged. I'm not going to go through the detail on this slide around home care because I'm going to dig into that in more detail shortly. But suffice to say that it's really important as a provider to understand your costs and service offerings as you look at the home care changes. And particularly look at how you can integrate CHSP and home care package models. There will also be growth funding opportunities in home care. In the residential care space, a really big change is a new funding model with the Australian National Aged Care Classification replacing the aged care funding instrument. And we'll talk about some of the implications of that for home care funding in the near future. We're also seeing a move to consumer control of residential care places, similar to what's happened with home care packages, and independent pricing, which while it will apply at first to residential care, will also apply to home care in the future. In terms of quality, we're going to see revision of the aged care quality standards. That process is already commencing. The clinical standards have moved over to the Health Quality and Safety Commission, and the Department of Health is undertaking the revision of the other aspects of the quality standards. There's also going to be additional quality indicators, excuse me, including in home care. Serious incident response scheme is coming into home care. There will be star ratings initially in residential care, but before too long in home care. And there's also going to be new building standards put in place. So for providers, responding to the new standards and the indicators and greater reporting requirements from home care will be inevitable. A big issue is Pillar 4, which is the workforce. So there's changes and new requirements for additional staffing in residential care. There's retention programs for registered nurses and care workers. We're hopeful shortly there'll be an announcement about a home care worker recruitment package and possibly a wage increase. And there's also changes to code of conduct that's coming in, as well as new worker screening requirements, which will be largely consistent with the NDIS. It's going to be a big challenge to recruit new staff while there's an actual workforce crisis on, and I'll talk a little bit more about that later. But there are opportunities for you to use government initiatives while you promote your own organisation as well. But you're going to need to ensure compliance with things like the new codes of conduct and screening processes. Pillar 5 is governance, and there are new board member and governance requirements, particularly initially for home care package providers, and they're currently in a bill before Parliament. So you are going to need to review your board membership and ensure that it complies with the new requirements and that you can undertake the additional reporting requirements that are in place. In terms of housing and retirement living, the state governments, including New South Wales, are adding additional Retirement Village Act requirements, but there's definitely opportunities for integrated housing and care models that are developing outside residential aged care funding. Again, providers are going to need to comply with new Act requirements, but there's also the opportunity to expand your housing and care models. So let me dig in now to the government's home care initiatives in a bit more detail. The Royal Commission recommended eliminating the home care package waiting list, and the government has announced 80,000 additional home care packages, 40,000 being released this year, another 40,000 next year. So that is going to give significant growth opportunities in home care packages for providers. There's the Royal Commission recommendation was to create a single aged care program that included residential care. The government has announced merger of home care packages, CHSP, short-term restorative care and respite care into a single in-home care program from July 2023, and they've extended the contracts for CHSP. And we'll talk more about the detail of that in a second. Some of the other measures for home care, there is additional funding to support informal carers, including additional CHSP respite services for another 8,400 older people. The government hasn't announced the funding opportunity for that yet, but we imagine that won't be too far away now. In terms of access to the system, so there's going to be a network of 500 local care finders put in place by 2023 who are going to be assisting people to steer their way through the aged care system. And they'll be building on the already existing pilot programs that COTA and FECA have been running. The Royal Commission, interestingly, said that user charges should be eliminated for in-home care. The government has not adopted that. They are going to review the user charge arrangements, however, as part of the creation of the new in-home care program. So at least in the short term, there's no change to CHSP or home care package consumer fees. The Royal Commission model for the single aged care program identified a number of service categories and proposed some different funding models for them. For respite support, they felt that respite in the home, in cottages and in residential care services should all be brought together, and that model should be funded on a grant basis. Social supports that provide social inclusion and community participation. This includes individual and group programs, including centre-based respite, transport and delivered meals, all were covered under this category. They again felt that that should be grant funded. In terms of assistive technologies and home mods, there was an identification of this being needed to support people's independence in how they perform their tasks. And this again would be a grant funded component. For other aspects of care at home, such as personal care, clinical care, enabling, palliative care, living supports and care management, the Royal Commission felt that this should be funded either by a classification system like residential care or an individual budget like the NDIS. And then they added residential care into the mix. What the government has announced is that it has commenced consultation on critical design elements for the Support at Home program, talking about assessment, classification systems, choice of providers, care management, support for informal care, and early intervention. What the department has revealed in the last few days is that it is developing a model with an electronic payment platform at its centre, which will allow for fee service payments to be made in real time to providers. They've announced, and this busy slide is taken directly from the department's website, they've announced a number of consultation and research projects that are underway at the moment. There's some research to look at the benefits of home care current programs and how to best support and inform consumers about any changes and the design of the new system. They're undertaking some stakeholder consultation, a study of up to 4,000 senior Australians about needs and costs of delivering home care. And then they're looking at comparing the needs of Australians in residential aged care with those needing home care package, and also looking at the issues for Australians with senior Australians with disabilities who are not eligible for the NDIS. Major piece of work has been around an assessment, classification and funding model for home care. The department has engaged Health Consult to do that. An initial report was received and is available on the department's website. This was completed in May 2020, and it identified that they're developing an assessment model tailored to tailoring the level of assessment to the level of the consumer need. A classification model that allows the consumer to be in more than one class concurrently, a funding model using tailored service bundles, and a classification and funding approach that funds reablement episodes separate to ongoing episodes. The department will be trialling and testing this new assessment model in the first half of 2022, and they're setting up an advisory group to actually provide some advice on that trial. In terms of the Commonwealth Home Support Program, the government has announced its timeframes for the CHSP Extension. So contract negotiation will be undertaken with providers in the next few months. There'll be some transition support available, and applications will be available early next year around that. Contracts will be finalised sometime from April to June, and then the funding for the extension year will run through the 2022-23 financial year. And then in July 2023, we begin the formal transition to the Support at Home program. As part of this, the department has released the national unit prices that it's proposing to adopt for the sake of the CHSP transition year. I'm not going to go through all of these. You can see them on the screen, and many of you will already have seen them in detail. They have adopted price ranges and will be negotiating with providers if your price range sits outside that. I would certainly be recommending that service providers understand your own costs, not just accept what the government tells you. And there is a model that Carrie Hayter Consulting has undertaken, which is now available and is being supported by ACSA. And I had a role in my consultancy service in setting it up as well, which allows providers to input your own data and understand what your own unit price actually is. I'd recommend you use that. What are the big issues for providers at the moment? Well, look, we know it's workforce shortages. That's number one issue. What were long-term chronic issues have now become an acute crisis. It's significantly due to COVID. The Australian Aged Care Collaboration, which includes ACSA, Leading Age Services Australia, and the 4 major church peaks, has proposed a package of 6 short-term measures to government. We've got a workforce survey underway, and we're representing the sector on the union's claim for a 25% pay increase in the Fair Work Commission. We know also that industry consolidation is real. While home care package provider numbers have doubled over the past 3 years, CHSP numbers have been steadily falling for a decade or more. We believe that the government's response to the recommendations is going to increase regulatory pressure on the sector, even if there is an improvement to financial sustainability. So we think there's a need for a proper aged care industry transformation plan that identifies a clear role for government, not only as a funder or a regulator, but also as a steward of the system. But we do recognise there's also a responsibility for provider peak bodies and all of you as individual providers as well. In the meantime, the pandemic continues. We've got the Omicron new variant just hitting Australia. So this is going to be a movable feast ongoing, and it's going to continue to absorb time for all of us. In order to get the Support at Home program set up right first time, ACSA has joined with other peak bodies to create an alliance for seamless aged care. This is Supported Home Alliance is around organisations that are passionate about the future of the home care system in Australia, as well as ACSA. We've got Community Transport Organisation, Home Modifications, Meals on Wheels, and the Neighbour-Aided Social Support Association, all working together. We've involved sector support and development projects, and also the Australian Health Services Research Institute at the University of Wollongong in a working party. That working party has come up with a seamless aged care position paper. And we've been engaging with members of the Alliance partners who operate in home care packages, CHSP or both. And it is intended as a contribution to the development of the new supported home program. We're going to continue the policy development into the new year with a second paper describing the potential design elements in more detail. Why are we calling for seamless aged care? Well, we want to make sure that the new supported home program recognises the strength of home and community care programs already. We're the bedrock of Australia's aged care system. We support communities through the provision of personal care, meals, transport, community support of various sorts, amongst all the other programs that CHSP and home care packages deliver. We're embedded in every local area across Australia. We provide services to people regardless of where they live, their culture, or their ability to pay. Our aim as an alliance is simple, it's to ensure the over 1 million people we care for are able to continue to live in their local communities, participate in everyday activities for as long as possible. And we want to be able to do this by drawing on the strengths of local communities, underpinned by lean infrastructures and overheads, and maximise our impact thanks to our vast armies of local volunteers. Our vision for supported home is that it will be built on the existing network of local services, activities and supports, both formal and informal. Excuse me. It will provide real choice for older people, be that through program-based delivery or self-managed choices or a mix of both. It will minimise burden on older people, for example, administration, rostering, unless it's their choice to do that for themselves. It will be underpinned by a localised planning framework and capability development that ensures an interface with the health system. And it will be based on a funding model that's equitable and sustainable for the future. To that end, we've proposed that the new supported home program, it does include a classification and funding system, but we're arguing that it should be one similar to the ANAC in residential care. Importantly, from our point of view, this will support longer-term sustainability of the vital community supports and volunteer activities our services provide. It'll provide real choice for older people because it'll be designed around meeting their individualised need, but it'll also improve accountability of funding and build a platform for meaningful quality improvement and outcomes measurement across the sector. Some of the content of this paper, it's going to be based on guiding principles. The first of which is around the experience of older people being at the centre of the aged care system, equity of access, and a focus on wellness and reablement. It'll recognise the ecosystem of the home care sector, accommodating the challenges and the diverse needs of thin markets, valuing motivation and contribution of volunteers, and allowing consistency of funding approaches across aged care. In terms of the experience of older people, we're going to be articulating it based on the rights of older people, taken from the recent Older Persons Advocacy Network statement about the human rights basis for the new Aged Care Act. We're going to be emphasising freely and competently exercised choice of care for older people. But we need the system to be explicit about where there are limits on service availability, either due to funding constraints or a requirement to pay for services. The funding model for support at home, we've got an aspiration that it accommodates place-based service delivery. So it's costed to recognise variance and complexity of place across Australia. That it mitigates the unintended consequences of market responses, as well as changes in the client base or the service environment. It recognises that services need to be scalable, but also sustainable, and enables the measurement of quality of life outcomes. We believe that using the concepts embedded in activity-based funding and the ANAC will help us do that. So a classification system with classes that describe the characteristics of those receiving care rather than simply describing what they receive. So a case mix system, not a service mix system. And a payment model in which there's an explicit relationship between cost and price, informed by regular costing studies. For those of you not familiar with it, the ANAC model has three key design elements. The first is a base care tariff for the fixed care component of the costs. Then there's a variable payment based on the individual care needs of the resident as determined by the ANAC class. And there's a one-off adjustment payment recognising the additional costs that a residential care service has when a resident first enters the aged care system. We believe that applying this model to support at home could yield benefits in that it'll provide some predictability for services through the fixed component. It'll allow for a seamless and integrated consumer experience as people move through low and high care and into residential care. It'll encourage providers to deliver beyond an output level. It will be accountable based on monthly invoicing for services delivered in arrears for the variable component. We believe the fixed component could be paid in advance. It also allow for flexibility and be responsive, supporting outcomes. The paper goes on to identify some key characteristics the Alliance believes should feature in the new support at home program. These cover areas such as how the system will be designed, how choice will operate, how we ensure quality and safety, how the funding system would include all levels of care, including high-level care, what the new system should look like in terms of the mix of providers, workforce volunteers, intersections with primary health, place of reablement and wellbeing, and very importantly, how we transition from CHSP and home care packages into a new support at home program. We're really keen to hear your thoughts about this seamless aged care paper. We will be releasing the paper in another week or so. Once it's out, I'm sure your side will absolutely promote it to you, as we'll be doing from ACSA and the other peak bodies will be doing. So we'll be keen to receive your views. We do intend to engage with other provider peak bodies, for example, via the Australian Aged Care Collaboration, and also consumer peak bodies, and potentially take the paper to the National Aged Care Alliance for a whole of sector response. Clearly, we're keen that this paper informs the sector's response to the government's preparation for the support at home program. That includes the CHSP transition year and the work that Health Consult is doing on the assessment, classification and funding model. But we are also aware that the Department of Health will be releasing its own discussion paper on support at home before too long. And we're keen for our paper to inform our response to the government once they release their discussion paper. So folks, there's a lot in there today I've covered. I'm very happy to now move to taking some questions from you all.
Great, thank you so much, Paul. Fantastic presentation, really, really informative. We do have a few questions and I welcome all of you again to populate your questions into the Q&A or into the chat. But let's start with one from Marcella. Thanks, Marcella. Paul, can you expand on the housing and care opportunities that you mentioned? Housing is generally seen as a state-based issue and care a Commonwealth issue. How do we deal with the disconnect, which is very real, to bridge this problem?
Yeah, that's such an excellent question, but also potentially we could spend the rest of the morning talking about it because it's a very complex area. I'll touch on three main things I think needs to happen. Firstly, what we're seeing is many providers that already have a housing component are extending to offer care-linked offerings to people. So I was on a presentation recently where Ingenia, who are a company that do a lot of retirement housing and other forms of housing delivery, were talking about a care model that they've been rolling out for their residents. And essentially what they've done is they've employed their own case managers, but they've got a contract with 3 home care providers who provide the care models, the care delivery into their integrated care and housing system. So we've got existing providers doing that either in their own right or in conjunction with home care providers. Second thing we're seeing is that some organisations are really starting brand new developments with care already integrated. Some are doing that within the residential care funding system. So we've seen village-style arrangements around dementia developed by both not-for-profit and for-profit operators in Australia. There's an example by Glenview down in Hobart. And there's a similar model by another group in Queensland where they've been doing that. But the first thing those organisations that do it within the residential care funding envelope say is we could equally have done it with an integrated model between a retirement housing or another housing model option and a care option out of home care. Third thing I'd say is that for people who are currently homeless, as I mentioned earlier, secure housing is really, really important. I have a concern about one of the moves the government is currently undertaking, where they're taking the old Assistance with Care and Housing for the Aged programs that were rolled into CHSP, and they're now saying that that funding must move to the Care Finder program. But the message we're hearing is that the Care Finder program is going to be limited to only looking at how you access formal aged care programs. It's not going to be looking at solving the housing issues, which traditionally the ACRC programs used to do. So from ACSA's point of view, that's a retrograde step. Just because the Commonwealth isn't responsible for housing in that sense doesn't mean that they should extract that aged care intervention for homeless people and leave housing to somebody else. That simply won't work as a model. So the government needs to get its settings right. We need to understand that the intersection between housing and care is fundamental to getting home care right.
Perfect. That's a whole nother session, isn't it, Paul?
Absolutely.
Very, very complicated. A question from Denise. Could you comment on the surety of CHSP funding for 2022-23? The Department of Health says 12 equal payments with a compliance audit after 4 to 6 months and potential adjustments.
I'm not sure I can answer, Denise, on behalf of the department to that question. From our point of view, if the department is talking about adjustments, you're going to need to look very carefully at what are you adjusting. If it's because your price was originally outside those bands and they're wanting to adjust you into the bands, then either they have to adjust the number of outputs that you're expected to deliver, and that may mean there's an impact on care delivery for older people if the government doesn't do that very carefully. Or what it means is that they're passing some risk back to the home care provider, the CHSP provider, around really what the costs of the whole exercise are going to be. So if you're over delivering, but the government doesn't want to fund you for that delivery, an adjustment could mean you end up out of pocket. So we'll be looking very carefully at what the government really means by that. And again, I'd be encouraging you all to look at that tool. It's up in the chat. I see the link to Carrie Hayter's tool has been put in the chat. Make sure you understand your costs so that if the government does try and adjust your its payments to you. You know where you stand, and you can argue your case. And if you need to come to your peak bodies, be they Meals on Wheels, Community Transport, Home Mods or ACSA, please do so.
Fabulous. Thanks a lot, Paul. A question from Gail. Do we know yet if the provider's initial assessment for services such as DA will have to be done in the home, as we currently manage the assessments over the phone because the RAS do an in-home assessment?
We know that the government is talking about changes to the RAS and the ACAT programs as part of this. So they've picked up a recommendation from the Royal Commission that there should be a single assessment process put in place. We also know from the early information that the government is putting up that they are indicating a streamlined process for people with low-level needs. So they may not need even the RAS level assessment that's been common for the past few years. So it could be that there's actually a reduction in the threshold for people to get access to a single service, for example, meals or community transport. We don't know the detail of that yet, and we don't know exactly what the government's proposing and how it thinks it'll bring the ACATs and the RAS teams together. So the assessment thresholds, I think, are something we'll be really keen to see in the detail from when the government does put out its discussion paper of what are they actually proposing on the ground and what will that look like. In terms of whether you'll need as an individual service provider to therefore do an in-home assessment, well, if the government does back out of RAS assessments for low-level people, then I assume that we will need to go in and assess the home. So there's some consequential changes if the government does change its thresholds for independent assessment, which will need to be factored in.
Perfect. Thank you. Hope that answers your question, Gail. A question from Danielle. Is there an opportunity for the Department of Health and external consultants informing the DOH to directly observe the delivery of care? The consequence of COVID is that many policy options will be discussed via video meeting, and operational issues and opportunities are usually best presented in the context of real life.
Yeah, look, aside from latest variants of COVID arriving, we are in a situation where at the moment there's, a reopening. I would always encourage people in government to visit the real world, visit, aged care services, spend a day in our shoes, that sort of logic. The reality is it's not their fault that they haven't been able to do that over the last year and a half. It really has been a pandemic. It's been an unusual environment. But it's a bit of a rarefied atmosphere in the department offices in Canberra, and it's not the real world that we experience as aged care providers or as consumers in people's own homes or day centres or whatever. So, always a good idea for people to understand the real world that their policy decisions impact.
Great. Follow-up question from Danielle. How do you think clients currently receiving service will transition into the new Support at Home program, Paul?
Yes, this is something Danielle and I were chatting about before the session started. The department, I think, understands that you can't shift over 1 million people by reassessing all of them. But we also know that historically, where there's been changes that have protected or, grandfathered arrangements for people, that has its own complications down the track. You're then managing 2 or 3 different sets of consumers with different rules around them, and that's difficult for the government in a funding or regulatory sense. It's difficult for providers as well. So I think this time round, the government will be keen to avoid some of that duplication of systems by having lots of different grandfathering arrangements. But by the same token, they're not going to want to have to reassess over 1 million people if they don't absolutely need to do so. The fact that they're talking about low-level service delivery, perhaps having a fairly simple, straightforward access to the system, may mean that many current CHSP recipients, they don't actually need to do any form of reassessment for this time round. I think their challenge will be that home care packages will be different. My guess is they are going to need to reassess home care package consumers in some form or other, but that is only a guess, and we'll wait and see what they say about how they're proposing that transition to occur.
Paul, does that mean that providers will need to be prepared to educate and communicate all of this to clients?
Yes, it's the short answer. So there will need to be, as there were with the CHSP grandfathering arrangements, and there were some, when the home care package changes were introduced as well, there were some pre-existing arrangements that continued for consumers, particularly around user charge arrangements when they changed. So yes, there will be a level of communication that will be needed. What the government has done on previous transition arrangements like this is it provides the sector with the information which they expect you to deliver to the consumers. And then it's a case of us turning that information into a communication from each individual provider.
Fabulous. Thank you. A question from Alana. Wages will be key to both workforce pressures, i.e. need to increase and attract to the sector, and will also be key to be able to work out financial viability, i.e. if not funded by government, may become unviable. Have you got any idea, Paul, of how providers should plan for the future in regards to this pricing?
So look, I think it impacts on pricing in a couple of different ways. The first is, go back to point number one, I've stressed a couple of times now, understand your own costs now, and that then allows you to understand the potential impact of any changes to your input costs, and the largest for any provider is staff. So you need to understand what that could be, and you need to understand what your base is for that. In terms of how this might be handled by government in the future, at the moment, as the Royal Commission data that I mentioned shows, we have an indexation formula that doesn't pick up cost increases adequately, and particularly staff cost increases. So at the moment, we have an arrangement that will tend to erode your capacity to provide levels of service depending on how quickly staff wages go up. That is supposed to change at some point. So one of the reforms from the Royal Commission is independent pricing. I very briefly mentioned it. So the Independent Hospital Pricing Authority is having its remit extended to include aged care. In the first instance, with the introduction of AN-ACC in residential care, it's going to take over the residential care funding arrangements from 2023 in terms of recommendations about price increases. And there will be regular costing studies done to enable that to be done accurately. We're not sure when it will happen, but the department has acknowledged that there will also be a transfer of home care pricing to that new expanded remit for the Hospital Pricing Authority at some point. So at that point, there will be an independent body from the department that is then saying, okay, if there's been an increase to costs, including staffing, this is what we recommend government does in response. So that will be really important for us to see. We believe that in terms of the Supported Home Alliance, that move to an ANAC style model that includes regular costing is really important. So there's an explicit relationship between cost and price. The third comment to make is, of course, around the current Fair Work Commission case. So the unions have lodged a claim for a 25% pay increase. That is before the Fair Work Commission. ACSA is one of the parties feeding in from the employer side to that. We've been right up front and said it's clear that we need a wage increase. But the key question is, will the government fund it? So our advocacy continues to be that the government should adopt what the Royal Commission recommended, which is that the unions, the government and the providers should all go jointly to the Fair Work Commission and say, this is what we recommend and this is what the government will agree to fund. They haven't done that, and they're not going to. I don't think they're refusing to do that at the moment. So as part of our election campaign, we will be talking to Labor, the Greens and others about, well, what position will you take into the election, and what then will a new parliament have to say around wage increases once the Fair Work Commission process works its way through.
Fantastic. Danielle Ballantyne, do you have something to add to this issue?
Yeah, just to add a comment, I suppose, for everybody in particular, you know, there's a very big focus for CHSP providers right now to understand their unit costings and how they fit in with the regulated pricing that has gone out, is that the world is ever changing. And so I deliberately asked Paul that question around you know, who's going to communicate to clients the new transition into the supported home program, knowing that it's likely to actually fall on providers. And so that is actually an additional cost for providers that we don't bear right now generally, but we need to start to anticipate that and build that into our costing model so that we can understand how to do that effectively and efficiently. Also, putting into our ongoing costing models as well, things around vaccinations, COVID vaccinations, reporting on COVID vaccinations. I don't think that's something that's going to be here for the short term, given, you know, we've had a changing environment in simply the last 48 hours alone. And providers needing to obviously invest in building new systems to be able to capture and report on that information continuously. So when you're looking at your costing models, don't just anticipate a today environment, but also start to anticipate how you think that change is going to transition in the next year to 18 months and what those additional costs are to you as well. And obviously take advantage of the Department of Health's ad hoc funding applications as well to support you to put new systems and things in place now, which will save you down the track as well.
How do you see, Danielle, the benefit in this, you know, transition reform time? The benefits, you know, we've discussed a lot, the benefits of partnering, working together.
Yeah, I mean, lots of organisations that are online have probably already made some, you know, already made enormous transitions. You know, Paul gave an amazing historical timeline of where, you know, home and community care to the current world has come to. And I think, you know, the key lesson that we all have is that those reforms, those like organizational transformations are often best done in partnership with other organizations than done alone. It's helpful because it enables you to baseline your organization in terms of understanding you know, what you do, what you don't do, what are other organizations doing or not doing, sharing that information, because when you do actually work together, I think then as a sector, we lift each other rather than try and keep information to ourselves and, you know, not baseline ourselves. I think it's really helpful when we can sort of understand how others are actually responding and know how to respond in that way as well. And, you know, it's going to be a tricky time. Paul and I have talked about, you know, 1 million people are going to transition. What does that look like? There's probably, you know, anywhere between 1,600 to 2,000 providers delivering services who will transition as well. that's a lot of mush going on all at once, and we're all trying to keep up to date, and we're going to miss things. But if we collectively support each other, we will collectively lift the sector, and then hopefully, you know, reach the goal of the recommendations of the Aged Care Royal Commission. Is actually incumbent on us to do that, to actually deliver in the way that, you know, it is intended.
And I think I'd add to what Danielle just said, that the challenge for the sector is the last decade or more has tended to push people apart because of competitive pressures, and you're competing into a home care package marketplace where you want to differentiate yourself from others in order to attract clients. That is not going to go away, I don't think, in the new system, but in order to manage the transition to the future, I couldn't agree more, Danielle. We need to work together. We need to share information. And we need the government, as part of its steward role that I mentioned, to actually be more forthcoming with the information it holds too, so that providers can understand the risks that they're taking if they develop new services. So I think we're looking at a bit of a reinvention of the community-driven, really the start point for where you know, your side came from, that sense of us all working together. And that's going to be really important for the future.
Fantastic. We've got time for one more question before I hand it back to Lauren to wrap up. A question from Sarah. Paul, how real is the opportunity for the sector to inform the new Support at Home program?
I think it's very real, because the government has not yet settled on a final model. It's clear from some of the presentations that people like Nick Hartland have made that they've got some pretty clear impressions of where they want to go, but they haven't worked it all out yet. The Support at Home Alliance has already been in contact with the department, and we will be arranging a meeting with Nick Hartland as soon as our paper is 100% finalised. And he's open to discussing with us what the future might look like, how it relates to the work they've already been doing. If we as a sector are firm in our position for what we want to see happen, we have a really good chance of influencing it. So let's join together, be strong, be firm, but also approach the government with a cooperative model, because we want to co-design this with them, with the consumers, so that we get this right first time.
More solutions, less problems, as you said before, Paul.
Correct.
Thank you so much for your time. Thank you, Danielle. I'm going to hand it back to the lovely Lauren to wrap things up.
Thank you, Paul. I think these were really good, positive, final, conclusive words. I'd like to thank you all for your attendance and participation today. And I hope you found it useful and it helped you think about maybe new things for and what could be the next steps in your organization. And thank you again, Paul, for being so generous with your time. We really appreciate that. And to everyone, please do not forget to fill out the evaluation survey, and feel free to join us tomorrow for the second webinar, which is Community Care Living with COVID-19, which will be with Dr. Fiona Robinson, a GP who works in the virtual COVID-19 hospital. Thank you so much. Stay safe, everyone, and bye for now.